Okay, last week we talked about 3 hip mobilities that you can use. Today we're going to talk about 2 hip strengthening exercises that you can add to your rehab or training program. The first of those is the hip hinge, or we also call it the RDL, Romanian deadlift. So the way we like to teach it is we'll have the patient or athlete use a stick on their back, and as you can see with Dave, he holds the stick above his head and below his hips. And we ask people to get 3 points of contact: the top of your head, the top of your back, and the small of your back. Maintaining those 3 points of contact will be helpful to teach Dave how to use his core and engage his core on the movement. So go ahead. So a couple things you'll notice here is I look to see, is he really engaging his core? Is he pressing his back into the stick? That's the first thing. You'll also notice because the stick is on his head, it makes his neck stay in neutral alignment, a thing that we see goes wrong a lot of times in hip hinge. Come up. If I was coaching or cueing him to go through this, I would typically tell him slight bend in the knee and then push your hips back rather than down. Go ahead. Another cue we like to give is a proud chest. Keep a nice proud chest. It's okay to let your chest face towards the ground, but you want to keep it open. And as he comes up, we teach him to squeeze his glutes and get just a little bit of pelvic tilt at the end. That's how we teach the hip hinge. Again, pressing the low back into the stick, proud chest, squeeze glutes, get a little bit of pelvic tilt at the end. The stick makes it very helpful to help people understand where their alignment is and gives them a good idea on the floor. So this exercise is the single leg hip hinge or single leg RDL. We always like to teach the double leg first because we find it helps athletes or patients learn how to load their posterior chain more effectively. But once you've progressed out of the double leg movement, you can go to the single leg movement. When we do this, we like to teach it up next to a table or a bench or something you can put your hands on for stability. So go ahead, Dave. They'll sink into the position, but we really want to see them get that back leg up, nice and neutral throughout their spine. It's nice to have the table there because it can help him with his balance. Then what I'll coach and cue him to do is take your hands off, squeeze your glutes, and come up. Go again. One of the biggest mistakes we see is people not getting this leg up, so there's a lack of hip separation. You always want to get a lot of hip separation, especially for athletes, because this is important in sprinting and different movements that they do. And come up. Should feel a nice stretch in the hamstring. One more. And when he's in this position, again, squeeze the glutes, keep the core tight, and come up. Single leg hip hinge or RDL. So these are 2 very helpful exercises. Both of them, we've shown you kind of just the introductory portion of it. Start people out on the double leg, then begin to add weight, then go to the single leg with the table. Once they get it down with the single leg using the table or assistance, then they can do a freestanding single leg RDL. The form will be a lot cleaner and you'll get a lot more bang for your buck. Stay tuned for next week for Andrea Staley, one of our IBJI therapists, to present more on the hip.